Hello, I'm Dr. Robert Cagle. I specialize in joint replacement surgery with the Mako robotic assistants, and this is my good patient here, Kinji. I try to question dogma as far as you have to make it to 65 years old or whatever these time points are. The nice thing about with robotic surgery and the hip replacements that we're putting in nowadays, they last so much longer than they used to. And with the precision and control that we can put them in with, I just don't feel like I need to tell patients you have to wait 50 years from your birth before you're eligible for a joint replacement. So I know not a lot of surgeons offer 38-year-olds, total joint replacement surgery, but I think with the advancements that we've made, I feel comfortable saying that this is probably going to last you for the rest of your life if you don't beat it up. So, is it a joint that you were born with? No, but it's pretty close nowadays. And as long as you avoid running and jumping, and even that's kind of debatable, this will probably last you a long time. Now, have you noticed any problems or anything that you would say, man, I made a mistake. Why did I do this at age 38? I should have waited, or are you pretty happy with your decision to have your hip replaced?
Yeah, I think my biggest regret is not doing it sooner. Being in as much pain and really just agonizing to do little things with my daughter. Not enjoying the 2.5 years. I got a lot of years with her, but just honestly not doing it earlier. How well it feels now.
Wonderful. Yeah, that kind of is a perfect segue. I always like to ask, if you have any advice for people that have arthritis or suffering and they're contemplating a joint replacement, what advice would you give them?
My advice would be is do your research, talk about it. I think where your parents thought of joint replacement and where it is now, I think it's a completely different story. For me specifically, I would have no hesitation to get my left done sooner than later, just so I can live a active lifestyle with my family. But I would say do your research, feel good about it. It's not what you used to think it is, and it's just with the new technology and everything out there, new procedures and new approaches, I think it's just completely different.
Mm-hmm. Yeah, I think that with the robotics and then combining it with the minimally invasive direct anterior approach that I call the cosmetic hip replacement, I think that's really changed the game for hip replacement surgery. One final thought, would you have any hesitation or recommending Dr. Cagle for hip replacement surgery or knee replacement surgery?
No, absolutely not.
Wonderful.
First got to go.
Perfect. Well, thank you so much, man. I appreciate your time. I appreciate you trusting me with your care, and really appreciate everything.
Looking forward to the next one.
All right. Perfect.
All right.